I would like to offer some counterpoints to my friend from Fairfax City. First of all, the school boards were already derailed from being able to make decisions that were consistent with the values of the children they were educating and their families, because instead of saying, go solve the problem, Virginia school boards, the state said, go and find a way to implement these guidelines. That was the direction from the state while we were not convened. It confounded the ability for school boards to make the decisions based on local politics, which is what we are attempting to achieve by protecting the independence of our school boards as they are closer to the people and are better able to discern how to proceed. The guidelines that they were directed to follow were in conflict with the CDC, they were in conflict with the American Academy of Pediatrics, and they created what I called an unsolvable puzzle for our school boards. We have a report from the state that 200,000 children of school age in Virginia do not have access to broadband. 173,000 do not have computers at home. Yet most of Virginia has gone to virtual learning. It is entirely appropriate for the General Assembly to give a counter perspective to what the direction that was given by the state when we were not in session and say, okay, this is where we are. Aren't we here to solve COVID problems for this session right now? This is where we are right now. We recognize the deficits that have been created by the decision-making that we've gotten to this point. Let's find a way to make it work for everybody. And for that reason, 200,000 kids spread across 132 school divisions would very easily be able to maintain social distancing. This is an appropriate way of us fulfilling the obligation the Constitution makes to every Virginian, and I strongly encourage this committee to support this bill.
Madam Chair, Dave Suderline.
Senator Suderline.
Thank you, Madam Chair. I so rarely speak in disagreement with the Senator from Fairfax City on things like this, but I think that Senator from Henrico is exactly correct. The Commonwealth regularly mandates very specific things regarding K-12 education to specific staffing ratios, regardless of what might be in that individual school district's best allocation of their resources. The governor mandated that all the schools shut down for the entirety of the summer. He then, during the summer, tried to make it so that they would all have almost the exact same return plan with the guidelines being provided the way that they were. It wasn't until the junior senator from Virginia Beach pointed out that their statements, if they were actually to be mandated and not guidance, would violate the state constitution. I think that making sure that our students actually have their K-12 education that they're constitutionally entitled to, we go all, and it's great that we do it, we go through all these things to make sure kids that don't have access to lunch unless they're at school, that they were able to continue to receive it. We found ways, and the schools did a great job in trying to get that to those kids. We need to find a way to get education into the hands of these children who don't have internet access at the levels necessary to receive the education through the virtual program. So I hope we will support Senator from Hanover's bill.
Madam Chair, this is Ghazala Hashmi. Thank you, Madam Chair. I just want to stress the point that the American Academy of Pediatrics is a little bit more nuanced than just recommending that students go back to school wholesale. They actually say that local school leaders, public health experts, educators, and parents must be at the center of decisions about how and when to reopen schools, taking into account the spread of COVID-19 in their communities and the capacities of school districts to adopt safety protocols. This decision to reopen schools is a complex one I fully sympathize with all of the parents, the students who are struggling and facing this crisis of education, but it is at the heart a healthcare concern, a healthcare issue, and it is best left up to the individual communities and the local school boards who have been elected to make this decision. We're not just facing a crisis of not having broadband access in certain rural regions. We're facing a crisis of also not having sufficient technology in the hands of the poorest in our communities. These individuals, even if they do have broadband access in their communities, many of my students in the city of Richmond don't have the capability to actually pay for that service. Many of these students are also facing a crisis of homelessness. So this problem is very profound, it's very serious, it's very broad, and it is a decision at this point that we have to leave in the hands of our local school boards. Thank you, Madam Chairman.
Thank you, Senator Hashmi.
Madam Chairman. Senator Dunnavant.
Senator Dunnavant.
I just want to make a couple
Senator
of...
Dunnavant, I just want to apologize because I have to turn around and try to see where people are because I can't recognize you. I know we're all separated like this for a reason, but I can't see you. So if you all will raise your hand, that would really be helpful.
Yes,
Senator
ma'am.
Dunnavant.
Thank you, Madam Chairman. I just want to make a couple of points. I actually agree with the senator from Chesterfield. This bill should include every child that doesn't have access to getting the curriculum wherever they are. And we should include it beyond people who don't have broadband. And we should make sure kids that don't have computers. Do you know I have parents that have reached out to me that have 3 children in school, and the school schedule is such that all 3 children have to be on the device in the home at the same time? They don't have 3 devices, even if they do have broadband. There are some serious flaws with how we're proceeding with education that have arisen out of COVID and the situation that we're in, and that's what we should be here fixing. And any child who is homeless, I'm going to say again, school is so much more than curriculum. The senator from Chesterfield is correct. We have children who don't have food security. 40% of our children are on free and reduced lunch. That means their families are at 130% of poverty or less. They don't have a safe place to be. That is why we invest in schools and the experts that we have there. So I agree with the senator from Chesterfield. We should be including more people because there are more crises that are evolving beyond broadband. But the American Academy of Pediatrics said almost again and again and again, don't let that be an obstacle to returning to school. For every variable that came up, they wanted to offer a solution. And they did say, leave the decision with the school boards, not have the state tell the school boards how to implement a process that would not result in the outcome recommended by the American Academy of Pediatrics. Thank you, Madam Chairman.